welcome to the Tee List. Today I have my very special guest, Dr. Y. So can you introduce yourself to our viewers today and share what inspired you to pursue a career in obstetrics and gynecology?
Well, first of all, I want to thank you for the opportunity to have this wonderful conversation with you. My name is Dr. Shawn Yunayev, and I've been practicing medicine now this is going to be my 18th year, all of which I've been specializing in women's healthcare, obstetrics, and gynecology. An interesting question, what kind of led me to obstetrics and gynecology, and I'm not going to kind of bore you with all the details, but it wasn't one singular event. It was a collective of different events that happened throughout my life, one of which included a really bad auto accident that my brother was involved with and nearly died from, and including also just happy moments where I went with my older sister, to her OBGYN appointments when she was, pregnant, and seeing all the pictures on the walls. And then I guess in medical school, it was probably the only field that I felt really incorporated all different fields of medicine, where you can treat, women from the very youngest of ages to oldest, and really gives you the opportunity to treat all different types of issues, not only dealing with pregnancy, but infections, heart disease, endocrine disorders. I mean, it really gives you an open-end book when it comes to treating all different aspects of medicine. And then the surgical aspect. I really wanted to perform surgeries. And general surgery just didn't do it for me. So obstetrics was it.
Okay.
Yeah.
So was there a specific moment or experience that solidified your decision?
There are moments throughout my career that have given me more inertia, more energy to kind of pursue this life. One event that stands out without question that is my miracle, is the one that I kind of almost reference and look to whenever I'm wondering, why am I doing this? So I was, I think, a fourth year resident. It was my last year of residency. And a patient came in. She was about 6 months pregnant. Unfortunately, it wasn't a healthy pregnancy. She had a cerclage, a stitch placed in at some point during the pregnancy, and came in very much in preterm labor and was developing a really bad infection. And so we had to deliver the baby, and the baby was not bigger than something that fit into the palm of my hand. Mm-hmm. And if I'm not mistaken, a little over a pound. And I remember how the baby was just covered in purulent discharge and pus, because the entire uterus was just occupied with that infection. Mm-hmm. And I recall that night, the very first night that, after the baby was born, the neonatal ICU team came to the mother and the family and saying that, not much that we're going to be able to do because, the baby was very premature and very sick and very infected. And despite all their efforts, it didn't seem like the baby was able to sustain life. And so obviously it was a very sad moment. And I distinctly remember not necessarily the patient or the husband, but more so the grandmother, and how affected she was and how emotional she was. And this was her first grandchild. And the next morning I remember finishing my shift and going into the ICU just to find out when the child died, because that was my feeling, that the child had expired at some point during the night. And I was pleasantly surprised when I found out the baby was actually still thriving. That the NICU attending came to me and said, I don't believe it. Just the baby's still here and it's still actually pushing. And 13 years later, the baby is graduating. His name is Max, and he's on his way to high school. And it's a really remarkable story about how the human spirit is not weak. It has the potential of really kind of pushing through, and despite the gravest of odds and obstacles, the spirit has a way to kind of really push through. So that I would say was probably, like I said, I refer to it as my miracle, just because I didn't expect it, and I have no reason to explain why it happened, other than faith and God, and so yeah.
That is a very moving story.
Yeah, absolutely. Yeah.
So let's dive into prenatal care.
Yeah.
When should a woman schedule her first prenatal appointment?
I try to encourage all my patients to really start as early as possible, just because the earlier the first visit, the better we're able to date the pregnancy and really start the appropriate care depending on the health and status of both mom and baby. So ideally, if they can get to me by 6 to 8 weeks, that would be the ideal, but we don't try to push any of our patients away. And so regardless of the gestational age, I accept and welcome all my patients with open arms. But the best is the earliest, just to kind of start the care as soon as possible.
Okay. So how often should she see her healthcare provider throughout the pregnancy?
Those 9 months or 40 weeks is really an opportunity for the patient to really kind of jump into the most that I think our healthcare system has to offer. And so I always feel as though, obviously depending on risk factors and the health of the mom and the baby, it should be as frequently as deemed appropriate. Mm-hmm. For the low risk, where there's really not much issues, I'd say once a month. And then as we get closer towards the third trimester, we start to do every 2 to 3 weeks. And then as we really get into the last month of the pregnancy, I'd say a weekly visit would be appropriate.
Okay. And what routine tests or screenings are performed during each trimester?
We kind of break up the testing based on trimester, where the first, I think, is really the bulk of a lot of the testing. It really kind of gives you an idea of health of mom and of baby, assuming there's no other clinical reason to do more testing. But the first OB tests really revolve around mom's baseline health and genetics of the baby. So screening for things like chromosomal aneuploidies, Down syndrome, is really done during the first trimester. Recently enough, in the past number of years, genetic testing has given us the availability of finding out the gender of the baby, whereas before, years ago, historically, it was more sonographic diagnoses. Now we've got this opportunity of really assessing the baby's gender just based on blood work, which is pretty remarkable and very popular, by the way. Second trimester, we start to look for specific conditions that the placenta or the pregnancy starts to create, and so diabetes is one of them. We also look at the structure of the baby, making sure that it's growing appropriately anatomically. And then really the third trimester, we kind of look to see if there's any issues that may arise towards the end. So the big one for us is always going to be preeclampsia, hypertension during pregnancy. So blood pressure for us is always a thing. And then also signs of infection, I think, would be like number 2. And then conversations. I always try to, advocate for more communication between my patients, just because the more I know from my moms, the better I'll be, because let's face it, I'm a man, so I have no idea what the hell you wonderful women go through during this wonderful, miraculous moment. But the more I hear from my moms, the better I am at what I'm supposed to do. So, yeah.
Well, I don't know if any of you guys know, but he is still my doctor. And during my experience, I looked forward to every single appointment.
It's very sweet of you.
I remember getting that genetic testing. You said the chromosomal. Mm-hmm. Yeah, that one. And I found out, I believe at like 12 weeks, mm-hmm. that I was having a boy. And I was able to I hosted my own gender reveal. I was not letting no one do it for me.
Yeah, so as you should.
It was a nice experience to find out early on.
Yeah, of course.
Through those tests.
Well, if I could just also mention, one of the things that I most enjoyed about your pregnancy was really the delivery. What's interesting is that we've got this whole large giant world out there with so many different backgrounds and cultures, and at the end of the day, family is family, and what your family at least showed me was how wonderfully supportive it was. To see everyone there, mom and all your sisters and everyone around you, and dad, and each one playing their part, and it really kind of was an overwhelming moment for me, and it's for me also a rare event where I can get surprised by a pregnancy or get surprised by a delivery and find myself being emotional. It was just your family kind of really brought it out of me. So it's still something that I remember. I remember the room. I remember kind of the layout, and those. I kind of mentioned previously that there are certain things that get kind of ingrained into your mind as a physician. Certain events, certain dealings. Most of them are great. Some of them are not. But yours was definitely, that delivery was something that just kind of it stayed. So.
Yeah, thank you for, because I started off with miscarriages and I was losing hope, and my mom was like, go to Dr. Y.
Yeah. I mean, your mom is wonderful. I've had the opportunity of working with some great providers over the years, and she really kind of stands out as one of the greats for me, just because she's always been there, helping, being super supportive when it comes to patient care. And then when she kind of told me about you and that what you were going through in the beginning, I'm like, yeah, let's do it. Whatever I can do to help. And I'm glad that you got pregnant, and baby Liam is here now, going on to 2. So awesome.
Wherever you go, I'm coming.
Okay. Well, I'm going to be in New York for the next couple of decades. So
okay, good.
Yeah.
So let's talk about diet and nutrition.
Yeah.
What are the most important nutritional guidelines for a healthy pregnancy?
Yeah. So one of the things I try to always encourage for my moms is not to fall into myths about pregnancy when it comes to eating. So one of the big ones is, you're not eating for 2, right? So the idea being is that the amount of additional nutrition that mom needs to help sustain a healthy pregnancy is not that much greater than what you normally take in for a daily allowance. So believe it or not, 300 extra calories is what's recommended. So that's like that's like a muffin or whatever it may be. But we try to encourage a healthy weight gain, realizing obviously that a lot of the weight gain during pregnancy is not mom, but baby and placenta and water retention. But weight gain is something that we're going to experience, and we try to be at least pragmatic about how much is healthy. So in general, it always kind of starts with what your weight was, what your body mass index, I should say, is at the time when you first get pregnant. And usually, if it's a healthy weight, I'd say about 30 to 35 pounds is the appropriate. I try never to encourage my patients to diet. I don't think that's healthy, but healthy food choices is probably the better way of looking at it. And activity. I'm a strong advocate for exercise. I think some sort of activity is important, not only for just weight, but also maintaining a healthy heart. I'm a big fan of prenatal yoga. I think the idea of strengthening your core, making your pelvis as flexible as possible is probably the 2 best mechanical tools for a really strong vaginal delivery. The focus is really about healthy eating, finding the more appropriate nutritional food choices. You can always cheat. I'm the first one to say never say no to a pregnant mom. Why get them upset? So if they want something weird in the middle of the night, whatever it is, then you get it for them. But it shouldn't be like the norm 7 days a week. Fruits and vegetables are important. I always say baked and grilled is better than fatty and fried. Fish, meat, all of those proteins are important. So just healthier food choices is really the goal.
Okay. So you did talk about exercise. Is there a specific frequency? Like how often should they?
Yeah, it's a great question. So I kind of usually follow the guidelines of the American Heart Association. And so moderate activity And by moderate meaning trying to incite a heart rate that's slightly greater than resting for about 30 to 45 minutes 3 times a week would be the appropriate thing to do. That what you'll find is you'll get the right type of exercise. You want to avoid certain things in that you want to make sure that you stay hydrated when you're exercising to avoid dehydration and cramping. Pregnant moms are a little bit more prone to syncopal episodes, fainting. So stationary exercises you should try to avoid. Right, weightlifting you should try to avoid. So whenever you're exercising, you should always be on the move. Whether you're on your treadmill or on the bike, or just after at the end of the day, just going with your loved one and just walking in the neighborhood around the park or something like that. Just something that just to get out and continue some sort of mobility. I would say is the really the goal. And 30 minutes every other day is really all that you need.
Okay. And warning signs. So what symptoms or signs should prompt immediate medical attention?
So there's a laundry list of things that we can go over, but and I'll definitely harp on some of the more important ones. I always say that if there's anything that you feel uncomfortable about, you call. Don't keep it in. And that's important just because I have moms that, will feel something in the beginning of their evening and say, let me just see what happens. And then they don't say anything. And then the next morning it's gotten even worse.
Yeah.
So I always try to encourage, say something as early as possible. Even if it's nothing, it'll at least give us the opportunity of ruling out the nothing, the nonsense. And then that way you'll be better equipped to kind of understand what your body's trying to tell you. The big ones always are going to be pain, bleeding, baby not moving well, breaking of, the membranes and your water coming out. Those are like the big obstetrical ones, right? And then obviously if you're feeling something is not right, if you're, throwing up persistently, if you're having chest pain, if you're short of breath. I mean, there are certain things that you could potentially say, okay, it's the pregnancy, but it's always better to evaluate, rule out the worst, and then say, okay, yeah, it's the pregnancy. It's always just better to speak up and not stay quiet.
So over-communicate.
Over-communicate, absolutely. I love communication. I love questions. The visits, I only see my moms maybe once a month for the most part. And it's really that opportunity that I tell them that, look, ask all the questions in the world. No question is a stupid question. Whatever it is, whatever thoughts or fears you have, we talk about it. I also kind of, mention them that if there's something there that I need a better answer to, then I only ask my moms to be prepared to follow me through that evaluation. So if that means, being a little inconvenient and going to see an extra provider, doing an extra test, as long as it's safe, then it's something that I strongly encourage and say that it's for your best interest and you want to make sure that there's nothing really going on. So over communication is always better than not.
Yes.
Yeah.
Are there any lifestyle habits like caffeine,
Right.
alcohol, smoking that need modification or ending?
Yeah. So the big ones, obviously, you don't smoke, and you don't drink, and you don't use any illicit substances, because all of these substances have a great potential in causing harm to the baby. Caffeine is an interesting one, just because it has the potential of causing certain events. So one is it's a diuretic, and so the more you drink caffeine, the more you urinate, the more you become dehydrated. And dehydration can lead to a number of different issues during pregnancy. It's also a stimulant, right? And so meaning it actually will cause your heart rate to potentially go up, which can then also cause the baby's heart rate to go up, which by itself doesn't mean much. But the heart has an interesting way of responding whenever it's tested. And if there's something, God forbid, wrong, and it starts to go up, then sometimes you could actually reveal certain arrhythmias, right? Certain irregularities to the heartbeat. And so even though we're saying, don't do it, caffeine may actually kind of display an abnormality that we didn't know existed.
Interesting.
As far as dietary restrictions, I try to never tell my moms you can't have certain things. Again, everything is in moderation, but if they enjoy sushi, then, eat sushi. But do so from a place that you feel comfortable and know that it's fresh, right? So the biggest thing about raw foods is the rate of contamination. And that includes cheeses, and that includes dairy products, that includes cold cuts, and includes everything that is not fully cooked. And you really have to be aware of bacterial contamination and infection and the impact that it has on mom. But otherwise, and baby, I should also incorporate. But otherwise, enjoy yourselves. As long as you're eating healthy, as long as you're mindful about what you're eating, then I don't try to, limit that as far as what you can consume. But absolutely, there are certain things that are absolute no, and the ones that I mentioned are pretty much it.
Okay. I want to talk about infertility and understanding it.
Yeah, sure.
So in the U.S., Centers for Disease Control and Prevention, or CDC, estimates that 10 to 15% of couples have trouble conceiving or carrying a pregnancy to term. It can affect people of all genders, and its causes are split nearly evenly between males and females. So what are some of the most common causes of infertility in women and men?
Awesome question. It's probably one of the more common things that I get approached with from my just daily visits. You kind of gave some pretty, important and strong statistics when it comes to fertility. And I always try to explain fertility to my couples as a pie chart. And so 1/3 is female related, 1/3 is male related, and 1/3, believe it or not, is unexplained. And that probably is the most frustrating because, if it's unexplained, well, how do you fix that? Yeah. We go through a pretty comprehensive review of a couple's fertility and history and try to figure out where the problem lies. And that includes doing a thorough history and physical. That includes doing the appropriate tests, whether it be semen analysis or checking to see if the fallopian tubes are open, or checking the anatomy and making sure that everything is where it should be. Hormone analysis. We really try to do our due diligence about making sure that we identify a problem. And the good news is that if no problem is found, there are some pretty great medications, safe medications, that have been proven to be pretty effective in stimulating the ovaries to produce more eggs, and that really kind of does the trick sometimes. The male infertility part, that becomes a little bit more problematic just because I don't, traditionally take care of men. So if ever we come across something that's male related, then, I usually refer them to a great urologist that I work with, and I have a good network of urologists that I work with. And we, get to the problem, and then they fix their issue, and then we kind of, come back and really start this the process. And I've had some really good results. The interesting part about artificial reproductive technology is that it is becoming more and more effective as we go through the years. And I tell my couples that whereas it was not as effective, let's say 10 or 15 or 20 years ago, now it's just a matter of, if you guys are ready, we go at it, and we'll get you pregnant. And the issue is not whether or not you'll get pregnant, but whether or not you'll have one versus two. So twins are our thing when it comes to these medications. So it's a pretty cool process.
Yeah, I know. For me, I thought once you are faced with infertility, there wasn't treatment. So
yeah,
that is very enlightening to know that there are options out there for people who may be facing infertility.
Yeah, I mean the biggest thing that I try to often tell my my couples is that once you start the process, and we try to also encourage more of a natural initiation, in that knowing your body, knowing when you ovulate is always going to be important. Also eliminating certain toxins that may contribute to infertility. So smoking, for example, is a pretty strong toxin when it comes to impacting not only sperm production but also egg production. So lifestyle is important, healthy eating is important, exercising is important, and we're here to really kind of fill in the gaps when everything else has been done.
Okay, good. 10 to 20% of recognized pregnancies end in miscarriage. 80% or more of miscarriages happen in the first trimester. Dr. Y, could you please explain the different types of miscarriages and how they're diagnosed?